This is One-on-One. We're here with Bob Garrett, who is the CEO of the Hackensack University Health Network. Bob, the remnants of a very dynamic and important discussion. Some of the folks are still here. The Commissioner O'Dowd is being interviewed right behind you. Graduate medical education. You and the folks at Hackensack brought these people together. We had a huge audience, great panel. Why was and why is this topic of graduate medical education so important to Hackensack?
Well, it's important to Hackensack as it is really to the entire state of New Jersey, and for that matter to the entire nation, because we have a physician shortage that's expected to continue to grow in numbers. So we really need to be able to address graduate medical education, to fund it properly, and to encourage physicians to practice in areas particularly that are in those shortage zones.
But here's the thing, Bob. Again, Bob's been with us on many of our different programs. But we try to make it relevant for the average person watching. It's not a clinical discussion for clinicians. It's for the average person. Make folks know, help folks know at home, Bob, why this is important to them, because they're saying, I'm not going to become a physician. Why is it relevant for me?
Well, why it's relative to them is that folks are going to need primary care physicians for their basic health care. And if you think about the Affordable Care Act that was just recently passed and is implemented, they're expecting, after hopefully the problems get worked out, that 40 million additional Americans will have insurance. They're going to need primary care. They're going to need primary care physicians. They're going to need primary care providers to take care of them. Otherwise, their alternative would be to go to an emergency room, which is not the best in primary care, or they may even have to neglect their care because they don't have access to the right provider, to a physician.
So graduate medical education is doing what in that regard?
So graduate medical education is helping to train physicians to become primary care physicians and hopefully place them in areas where the physician shortage is most acute.
And Commissioner Mary O'Dowd from the Department of Health talked about today a very significant increase, a $40 million increase of state dollars going to graduate medical education. Let's talk specifically about what that investment means and how it directly affects the programs you and your colleagues are involved in.
So that's been huge for places like Hackensack University Medical Center and other academic medical centers in the state of New Jersey. So
break it down for us.
So as a result of that type of funding increase, we've been able to train from 110. We increased our training from 110 residents to 150 residents, which is a significant increase. We were able to...
That's potentially more physicians.
More physicians. We were also able to start a new training program in emergency medicine, because we're gonna need that. That's part of the primary care physician issue that I just spoke about. So the funding that the Commissioner and the Governor have provided to academic medical centers has just been a huge development and a very positive one in training physicians, and hopefully ultimately to address the physician shortage in our state.
And Bob, some of the collaborations that were talked about here, describe some of them and describe why they are so significant.
Well, we have academic partnerships with a few different institutions: St. George's University in Grenada in the Caribbean, Rutgers University right here in New Jersey, Stevens Institute in New Jersey, and then Georgetown University down in Washington, D.C. So through those affiliations, we're able to train students. We're able to increase our residency slots, and we're also able to influence curriculum at the medical school level to reflect what's really going on in the real world. So
what does that mean, influence curriculum?
Meaning that that medicine has changed. It's more of a team science now. It's more collaborative between physicians and advanced practice nurses and pharmacists. It's a real team approach. So you have to start to train medical students to be team-oriented back when they first start medical school. Through our affiliations and partnerships, we're able to deliver that message that the team approach is really how medicine is going to be delivered in the future, and therefore the medical schools will adopt their curriculum accordingly. And it's been a real success story.
Today is a very important day.
It really is. It's this type of forum is important. I think it's important to the healthcare system in the future. It's important for people to understand what we're trying to do to address the physician shortage here in New Jersey and really throughout the nation. I would encourage more of these forums to take place not only throughout our state but throughout the nation in the future.
Dr. Feldman and Dr. Boskamp, two of the experts on our panel talking about graduate medical education here at Hackensack UMC. Important discussion. Both of you have dealt with this from a variety of perspectives. Dr. Feldman, let me ask you, the biggest takeaway for you in this discussion, regarding graduate medical education, what we are doing well and what we need to improve?
I think what we need to do is we need to continue to create unique teaching environments for residents and potential residents that will attract them to come to our institutions and to remain there. So I think that's what we're doing here, and that's what we need to continue to do.
What's interesting to me, Dr. Boskamp, is once the issue of debt came up, meaning sometimes, very often, a student will go into medicine, and by the time they graduate, they've got a debt of approximately, let's be conservative.
Well, I mean, there are people out there that have $350,000, $400,000 worth of debt. It's a big number. And it's not just the debt from the medical school experience. They often have undergraduate debt as well. So that you add that on the first 4 years, an additional 4 years, then you're going to work as a resident at a salary that is not high enough to allow you to really begin paying off much of that debt. And you're really behind. You know, by the time you finish all your fellowships, your training, people are often well into their 30s.
And Dr. Boskamp was saying that very often that could potentially influence the decision a young physician will make as to where he or she will practice, what field. We need more primary care physicians, but you were saying sometimes they don't go into that field, right?
Absolutely. I mean, it's a disincentive. You might want to work in primary care, but it's just daunting to think, since that it's the lower end of the spectrum of how physicians are paid, that you may not be able to make the choice of what you exactly want to do, and you're driven to another area that society may not need as much.
And the problem with that is?
The problem is that you're you're forming an incentive to push docs into areas that may not fulfill the societal need. And so, you can't have everybody in the country reading x-rays. It just won't work. You have to have people doing primary care.
Dr. Feldman, jump in on this. It's important.
I totally agree. I'm in a specialty that's considered primary care, as Jeff is, pediatrics and emergency medicine. And you need to be able to create situations that doctors feel that they can go into a field and then have their own personal life afterwards and be able to afford to do the things that any other family would want to do without this enormous debt hanging over their head. And I think today's discussion brought up some of those approaches, innovative approaches that can accomplish that.
As a resident, you're the only resident here today. Everyone was talking about graduate medical education, but you lived it, you're in it, you don't understand it. When you made the decision to go into medicine, what was the driving force? What was the thing that said, yeah, I'm doing it, in spite of all the challenges?
I think the biggest thing for me was, especially in the emergency department, people come to me on the worst day of their life most of the time. And I want to be able to provide the care, be the person there that can help them. And what I'm learning here at Hackensack is how to actually do that for them.
What else do you hear? You heard that from Terrence, but what do you hear from others? Is it a comparable reason or a whole range of reasons? Why?
It is a range of reasons based upon their background, but I think that they really appreciate the power and the opportunity to be a physician, and along with that, the training that's required of that. So, I think we're getting the right people, which is one of the most important things, is the right people for the job. So people that really feel that passion, that are doing it for the right reason, and then when you combine it with that, it's the long days of studying, of working and stuff, that even though they're long hours, which they often can be, that drive keeps you getting up in the morning. And if you can get up in the morning and you're excited to come in, put in your time, learn about it, it says a lot about you as an individual, but it says a lot about the institution and hopefully the program that we have to be able to motivate, inspire people to reach their dream.
Before I let you out here, why'd you go into medicine?
Well, why I went into medicine is that growing up, I didn't have a family member or close friend that was a physician. So I sort of did a lot of kind of research on my own. But I have to say that I recognized early on what a gift and what a privilege it is to take care of a patient. And as we said in the emergency department, patients are coming in, and it's one of the rare times where they can't select their doctors. They're coming in based upon faith, so they're hoping that the physician can take good care of them. And I think that it's real powerful to be able to go in the room, make that connection, and use all your years of training and expertise to be able to make a good impact for them and sort of gain that trust in a short amount of time. And if we can capture that and always hold on to that, then I think that we'll be inspired for life as physicians and hopefully be able to inspire the younger generations of medical training.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org or find us on Facebook at facebook.com/Steve Adubato, PhD.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, Activists in cooperation with the American Medicine Chest Challenge, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.